Right. Thank you. Thank you. So, like I already introduced, I am one of the instructors. No, don't go there yet. Go back. Back. I'm one of your instructors, and I will be, yeah, I'll be facilitating 4 different courses. This is one of the courses, and it's PHT 119, as you have seen, is non-sterile product compounding. The learning objectives for this particular course will include the definition of what non-sterile compounding is. And for us to actually understand that, we'll also look at what sterile compounding is so that we are understanding what non-sterile and sterile are. And also the importance of why we're discussing about non-sterile compounding. We'll also look at trying to identify the common dosage forms. When you compound, what are the common dosage forms that we have for the purpose of compounding medicines. We'll try to describe facilities, equipment, and some safety standards involved in compounding, non-sterile compounding. We'll also come to the course where we'll talk about sterile compounding as well. And then we'll end with, for non-sterile compounding, quality assurance, and regulations. We also have like a short quiz questions at the end of the course. So for the purpose of effective learning, the format I would like to use, please don't go yet. Don't go back to that slide. For the purpose of effective learning, the format I would like to use is low dose, high frequency. We will take just a few slides. We'll not attempt to finish everything today. We'll take just a few slides, ensuring that we're just taking something little, but then we'll go through this course in 6 weeks, in the course of 6 weeks. So we'll take it, just a few slides, discuss, understand before we move on to next set of slides, like that. So we're going to adopt the low dose, high frequency approach to learning. And I would appreciate that you ask questions as we go along. I think it's best. At any point you have questions, indicate, would allow you, and then you ask your questions, we'll clarify before we move on. Don't keep the questions hanging for too long so that you don't miss the context and the learning, miss what we're supposed to be learning. So you can now go to the next slide. Let me now set some form of background to why we're learning about non-sterile compounding. And I'm going to set it in the context of patient-centered care. And I don't know if you, as students in the course of your studies, you've come across that patient-centered care. But I wanted to first set that background to say we're learning about compounding in that context of caring for patients, trying to meet the needs of patients. So it's called patient-centered care. And the main difference with patient-centered care and the other type of care, which could be focusing on diseases or the health system's convenience, is that the patient-centered care places a lot of focus on needs of the patient, the values of the patient, preferences of the patient, and the experience of the patient. You want to ensure that you're meeting all of this. You're meeting the patient's need while on admission, or if it's an outpatient that comes to you and goes back home. And you want to consider a few values, and we'll talk about all of this soon. Preferences and experiences. So in decision making as the healthcare provider, the system will want to ensure that you're placing focus on the patient rather than the disease or what the health system convenience is, what the health system can provide. So say, for example, you have a patient who is on admission and he's been diagnosed with simple disease, let's say malaria. Now, rather than trying to say to the patient that, since you're on admission, we'll give you injections, we start today, in 2 days' time, we round up, we make sure we clear. You want to be sure that if the patient says, no, I'd rather take tablets while I'm here, you want to make sure you're listening to why the patient is wanting to go that way, and checking if you will get the same results or even better results with using tablets rather than going the way of injection. You don't want to say, I'm the person prescribing this medication to you, I am the caregiver, this is what you take. Oftentimes you find that in the hospital. So the idea is that the focus here is on patient-centered care. And as we proceed, you'll get to find out that compounding of medicine, non-sterile compounding especially, is a key role for pharmacy technicians in any setting where you have a pharmacy or a dispensary or where medicines are supposed to be given out. So I wanted to put this on the table to say that we're looking at non-sterile compounding in that context of saying a patient is in the hospital. We want to make sure that we're not just providing care based on what the system is saying or what diseases are saying or what the books are saying, but we're making our decisions based on some of the needs of the patient, his values or her values, preferences, and then experiences. Now, there are a few key principles of patient-centered care, and all of this would lead up to when we'll now begin to talk about non-sterile compounding, and we'll see the need for this. The first one is that the care should align with what matters most to the patient. I've just given an example. I've just highlighted an example where we'll have to be sure that if the options were provided to the patient doesn't seem to be the one the patient wants, and we know that that will not produce the good results we want, of course, we'll have to then go into the other principle, which is information, communication, and education. You have to ensure that you're communicating with the patient. It's the patient's right to know the kind of treatment he or she will receive, and then giving them enough information to make informed decisions, honestly, that this is why we're doing this, and so that we're making sure the patient is comfortable. I'm saying this because you'll find it really important when we now go deep into the discussions on non-sterile compounding. You also want to consider, ensuring that the patient receives every care seamlessly. If there's a coordination with the laboratory or other sections of the hospital, say nursing or other parts, you're doing that seamlessly without making the patient go through knowing that there are issues here. You just coordinate and ensure integration of care and ensuring that everything is going as planned. You have to look at the patient's physical comfort. You have to address issues around pain, their daily needs and supportive environment generally, just to make sure that the patient is well taken care of. There will be a need for emotional support as will be required if there are issues around fear or anxiety or any such stress-related things. You have to cater for the patients in that way. Involvement of family and friends is really key. Recognizing that their role in patient care is really very valuable. And then we'll have to think about continuity and transition. which then prepares patients for the next phase of whatever treatment you're giving. Now, I'm rushing this because this is not like the key, but I think it's important we have the context of why we're even talking about non-sterile compounding. And that's why I'm going through this. Now, some of the major benefits of why we should adopt patient-centered care is that it improves the satisfaction and trust of the patient. As a caregiver, as somebody who works in the system in the hospital, it's important that the patient is satisfied and they trust you, that whatever treatment they are going through or services you're providing, they're able to take them on and hope that they get better. It will enhance, if you do a patient-centered care, it will enhance things around adherence and ensuring that the patient gets good health outcome. It will also reduce medical error. If your care is centered patient, you're ensuring that you're looking at all safety precautions. Then it will help the patient. And lastly, it just encourages more efficient and coordinated use of resources. If your care is, if you're, focusing on the patient-centered care. Now, having said this, I'd now like us to move into what non-sterile and sterile compounding is. So before I go on, let me just pause and see if there's anyone who can just quickly give us a differentiation of what sterile and non-sterile is, if you want to try, in the context of pharmacy, medicines, compounding. What comes to mind when you hear non-sterile and sterile? Compounding is compounding in the real sense of the word, where you bring a number of things together into one place and try to make them one. That's compounding. So we're talking about bringing components of medications, trying to put them in a single place and make them into one particular medicine that could be applied or taken. So I've given the visual compounding. So who would have an idea of what sterile and non-sterile is? I want to pause here and take a few thoughts. Anyone want to try? I want to be sure I'm not speaking to myself all along. Should I mention names? Okay, no one wants to try.
Okay.
Yes, carry
Non-sterile.
on. Yes,
Non-sterile refers to an environment or object that is not completely free from microorganisms, maybe
correct.
such as bacteria, viruses, or fungi.
Good, good, good. Absolutely. So, which will mean that,
Then
which,
sterile is vice versa.
yeah,
It's an environment that is free from microorganisms.
absolutely, absolutely. Good. Thank you, Precious. That was a very good one. So, she just explained that to us. The difference simply means that if you're doing you're trying to compound some medicines, non-sterile compounding will mean that you can do that compounding in an environment that is not necessarily completely free of microorganisms, germs, and all of that. So it means that it's okay to do the compounding in that situation. You don't have to put too much effort trying to ensure that everywhere is sterile and all of that. And you can understand why. And this is principally determined by the route of administration of that drug. So, for example, drugs that will go into the mouth orally, we have natural defense systems. So, if you prepare it in a non-sterile environment, it's okay, as long as everywhere is neat and the medication is done in a way that ensures safety. It's not a problem. Think about ointments, creams that you have to rub to clear some diseases from your skin. You can prepare them. They go to your skin, the skin is a very tough organ of the body. It can actually take a few, if there's a few organisms here and there, there's no problem. It can take care of it. And then even medications that are used rectally, inserts, you can prepare those ones in that environment. But there are some other, just to differentiate them from sterile compounding, there are some other medications that if you need to put them together, bring them together, you will need to do that in an environment that is completely clear of every microorganism, every viable microorganism, every living microorganism the environments must be clear. And such medications would include things like injections. If you're going to prepare injection, something that you inject and goes directly into the bloodstream, you have to make sure that that is being prepared in an environment that is completely free of, any germs or organisms. Things like eye drops, things that go directly into systemic circulation, and some, spinal fluid, IV fluids, and, drips. When we say IV fluids, drips. So we have to make sure that the environment is completely sterile. So we'll come to sterile compounding for the purpose of today's lecture. We are talking about non-sterile compounding, and we've just explained that you can do it in an environment that it's you don't have to work too hard to make sure everywhere is over clean, as long as it means minimum cleanliness, and all of that. And then we've also said that there are certain routes of administration that, when you're compounding medications for, you can do it in a non-sterile process, which includes those going through the mouth, skin, rectal, and other things. Let me take a minute to explain that there's a difference between compounding and manufacturing. Again, linking it back to patient-specific care, that's patient-centered care. Compounding is normally something that you do for a specific patient for certain reasons. We'll go into the reasons shortly. You compound medications for a patient for certain reasons. While manufacturing, I wanted to differentiate between compounding and manufacturing. Manufacturing is the production of that medication en masse. Paracetamol you want to produce. If you're manufacturing, is probably a factory industry where it's produced a mass and then sold and distributed. But compounding will mean taking the pieces and you yourself putting them together to produce something that will be used by a person. So you see why our context of patient-specific care was really important to set, because this is now something you're producing for one person. And most often, medications that are compounded for persons will have, in most cases, life-saving implications. There are reasons why the medication you're not just taking off the shelf and telling the person, you see this one is paracetamol, you see this one is amoxil, take this one, then take this one. There's a reason why you're compounding them together, putting them in a container and making them one. Or you're taking ingredients from, off the shelf in a pharmacy laboratory, and you're putting, some syrup here and putting some active pharmaceutical ingredient here and putting in specific measures to bring them together. There are reasons, but mostly they have life-saving implications. For example, if there are kids that require, if there's a kid that require a certain medication that is not in liquid form, and the person is a kid, swallowing is a problem for kids, you have to now take that medication and, put it, compound it in such a way that it's available to the patient. Or maybe there are two different medications that are put together to compound and make them one. So, that's some example that, I wanted to just differentiate between compounding and manufacturing. and the reasons why compounding is always important, and I've said is a key role for pharmacy technicians to compound medications. When the prescription comes and the pharmacist looks at it and he says, oh, this we cannot have off the shelf, we'll have to compounding. Normally is the pharmacy technician that does that compounding. Before I go before I move on, let me also mention, as you can see on the slide, there's something about guidelines. Guidelines are really, really important in compounding. So when there's a need to compound, you don't just take the prescription and go to compound like that. There is what we call pharmacopoeias. There's British pharmacopoeia, the most popular, British pharmacopoeia and US pharmacopoeia. Now, these pharmacopoeias are very huge documents, like volumes of documents that prescribes every step of how to prepare any medicine that you know. So for every medicine you know, there's a standard process of how to prepare, and that is contained in a book called Pharmacopoeia. I'm hoping that you would have come across that word or have heard about it. So the Pharmacopoeia is like the Bible for every, or Quran for every pharmacist. It spells out everything you need to do to make sure you're doing the compounding or manufacturing according to standards. If you're compounding or manufacturing, their standard, it spells out everything, the constituents, the diluents, what active pharmaceutical ingredients, in what proportions, by, if you're preparing for a child, an adult, everything is specified there. So just to say that compounding or manufacturing that you're going into must be according to these guidelines. There's a United States Pharmacopoeia. When we get there, there's maybe in the next lecture, we'll talk about this pharmacopoeia a little more, and we'll talk about what it prescribes every standard you need to follow for that manufacturing process to take place. Let me stop here and see if there's any question from anyone. You have any thoughts, any questions? Like I said, we're going to be doing low dose, high frequency. I believe in taking it step by step. We understand before we go into the next one. Is anything I've said so far requiring clarification, or do we silence means consent that everything is clear? I'm taking a minute to say something to see if there are any questions or thoughts concerning all that. Otherwise, I'll ask a question. Has anyone here ever gone into, have you ever encountered a medicine that had to be prepared specifically for a patient? Has anyone had that experience? Any medicine that was prepared specifically for a patient? Have you come across that? Anyone? Of course, not the pharmacist in the call I'm seeing. Anyone, have you come across a medication that had to be prepared for someone who is, ill in the hospital or at home? None. Okay, so let me continue. Okay, someone wanted to
Okay,
speak?
so
Yes, Precious. Carry on.
I've entered at home, but it's herbs, so it's not English
Oh,
medicine.
okay. All right. Thank you. Thank you. That's helpful. But all right, I'm referring to, medications that were prepared specifically for somebody in the hospital. But thanks, that's helpful. Of course, herbs are normally prepared at home, for people. Yes, so let's go to the next slide. Let's go to the next slide. So there are reasons why we'll have to prepare compound, so like you already know, when you go to any pharmacy, there are medications and medications on the shelf, but there are reasons why sometimes you cannot just lift the medication and just ask the person to take. And we started giving examples. So, first example we're giving here is in liquid forms. I mentioned that earlier. When you have a particular medication that a child must take because it's supposed to be life saving, supposed to help the child do something, but you do not have that preparation, that medication in the liquid form. It could be that that medication does not exist in liquid form, only tablets, but there's a need that the doctor is prescribing that. So you need to now take a portion of that tablet, cut it, crush it, and then mix with something to make the child be able to take it. It could also be that in the pharmacy where you work, at that point in time, in the state, they've looked for that medication, the liquid form and preparation isn't available. But we have the tablets, which is meant for adults. So why don't we take the adult dose, do a pharmaceutical calculation, crush it, and then mix it up with syrup, some flavors, so that we can then administer to the child. So there are needs. So again, pediatrics, very little kids needing liquid form of certain medication for some of the reasons I've mentioned. You may have to compound them. It's a key skill that every pharmaceutical farm tech technician must have, and is also a requirement for every pharmaceutical farm tech graduate. Another example of why we have to do non-sterile compounding is allergic patients needing preservative-free medications. So the medications exist in the way they should be, for every medication, you see there are a lot of things, active pharmaceutical ingredients, some water, some other liquids, preservative, coloring agents, anything to make it, some sweeteners and all of that. There are so many, sometimes we talk about the active pharmaceutical and call the rest excipients, but you have to have a number of things put together to form a medication, and which is why I say we must follow the guidelines, which are contained in the USP, United States Pharmacopoeia, and then United States and then British Pharmacopoeia. So you find out that sometimes you have patients who could take the medication, but the issue is that they're allergic to certain components of the medication. So what do you do in that case? You take the ingredients that you will normally have on the shelf in the pharmaceutical laboratory and then put them together minus that particular preservative, if that's the problem, so that the patient gets the medication but without that particular ingredient, or substitute the preservative with another preservative that the patient will take that will not be a problem for the patient. So I'm telling you reasons and indications for why we need sterile compounding. We have millions of medicines on the shelf, but we still need, sometimes there will be need for compounding. And this is really, really important. Again, we're saying once your environment is clean, you disinfect the table, your bowl is clean, your pestle and mortar clean, your pipettes for measuring the liquids are clean. You don't have to worry about, having a particular boot or covering that would first eliminate all the germs and all of that. No, you can prepare your medications in a very clean environment and get them to the person. So you see, again, patients allergic to certain preservative, it's still about listening. It's still about our patient-centered care. It's still about listening to the patient and understanding that, oh no, this medication, did you say there is this? Oh no, I don't take this. I react. I have Steve Johnson syndrome. I have something that comes out of my body whenever I take this particular ingredient. So you have to listen to the patient, and then rather than give them the one that was already manufactured, you now have to compound for them. So that was another example. Another reason for why we do non-sterile compounding is that there may be customized doses that are not commercially available. What I mean by that is every medication comes, like in certain strengths and dosage forms and all of that. So, assuming let's take paracetamol, a very common one. The strength is normally 500 milligrams. You know that. So for adults, they will tell you, oh no, you need 1,000 milligrams twice, 3 times daily to cure your headache or something. Assuming there's a kid that needs to take that medication, but not 500 milligram. This kid needs just 250 milligram, or maybe just 150 milligram, based on the weight of the baby, or some other criteria. It means you will have to take that medication and then do the calculation and then help put together the compound that particular portion for the person to take. So that could be a reason, an indication for why we will need to compound. We're seeing the reasons for why we need to compound. And then special populations. Geriatrics are people who are very old, 70, 80 years above. We've talked a lot about pediatrics. Geriatrics are also there. Uh, at the age of 70, 80, 90, sometimes, age-related issues, health issues could mean that the patient is not able to swallow. Or take, for example, HIV patients that have one symptom called oral thrush, where there's some fungal growth around the neck. So swallowing becomes a problem. In that case, you may have to help convert that tablet that old person is supposed to take into liquid preparation, syrup, something to aid the passage of that medication. So that could be another reason. There could also be veterinary compounding. These same medicines that you see on the shelf, you could also have a need to, put one or two together and then give your maybe chickens. If you're rearing chicken, there's a need to put maybe some antibiotics, but not in the formula that humans will take because our weights will be different. A chicken's weight will be different from an adult's or a child's weight. So we may need sometimes to do those compounding. Yeah, so these are indications. In pharmacy, when you say indication, you're saying the reason for why you have to do what you're doing. So these are indications for you to take this medication is that you have headache, you have this is indicated for headache, indicated for stomach ache. So indication means reasons why we need to. I would also stop here for a minute and see if there are thoughts or questions. It feels like I've been speaking all alone, and I'm supposed to be actually instructing, facilitating, and we're not teaching, we're just instructing and facilitating. Yeah. So I'll stop and see if there are comments so far. There are thoughts on what I've just finished describing. No comments. No thoughts. I hope that as we continue with subsequent lectures and other courses, we'll have this interaction as we go along. You stop me, ask questions, or a thought comes to mind, please stop and let's share. Because again, learning for me is not just going through the curriculum, it's actually, is actually interacting with one another. Okay, if there are no questions or comments, let's get on to the next slide. Next slide, please. Next slide, please. Okay, so in this next slide, what I just tried to do is just put together, something you can relate with pictorially for us to just look at and see that when you do compound, non-sterile compounding would normally revolve around these routes of administration, and these are some common examples of what you have when you do non-sterile compounding. For sterile compounding, we said is another course altogether. We'll take that. We'll look at the routes that you commonly do compounding for. For non-sterile compounding, the common dosage forms include include oral, orally taking medications, like solutions. Solutions are those medications that you are given that are contained, that are in liquid form. But the difference between solution and suspension, I'm sure you would get to know that in some other courses. Difference between solution and suspension. The solution is normally, um, when you take it, is all liquid. All of the active ingredients have dissolved into the diluents, and then you just take it and just put it, measure 10 mils, 5 mils, and take. For suspensions, you normally see that there may be a portion that looks a bit like um, solid, like powdery form, and then top will be clear liquid that you may need to shake and mix so that both mix together at the point of taking them. So again, we can have a reason why for orally taking medications we're doing a solution, and all of that is contained in the British pharmacopoeia and US pharmacopoeia. And I learned as part of this course, you have the opportunity to do a 6 months internship. I hope that will be in a pharmacy or hospital or an environment where you have the opportunity for compounding, so that you are able to see how these things are done using the British pharmacopoeia or US pharmacopoeia, and seeing how you follow the steps all the way until you meet the standards. So it could be solutions, could be suspensions, could be syrups, syrups, the ones that have the the medications that have things that look like honey, syrups. You all know syrups. You could have a need to dissolve some active pharmaceutical ingredients into the syrups and make them available. It could even be, you're compounding something and ending it up in in tablet form or in capsule form. All of that can happen. You can get different active ingredients, put together, compound them. When you're finished compounding, there are machines that within your laboratory can make them come out as capsules or tablets. But you have put together the right things that were not found as a single container of medicines or something. Yeah, so these are the common dosage form for non-sterile compounding. We also have topical medications. Topical means skin. Topical medications means skins, medications that are applied onto the skin. And for that, we have creams, we have ointments, we have gels, we have lotions. All of these actually have reasons why they are different. There's a difference. You have differences between creams, ointment, gels, lotions, all of that. And like I mentioned, in the British pharmacopoeia or US pharmacopoeia, you have the different things that you put together and in what formula to make all of this different. So you'll have to have all of this. You can also prepare this non-sterilely. And then rectal and pastries, suppositories and pastries, rectal and vaginal route of administration. You can have that as one route of administration, where you have, for certain fungal infections, there are tablets. They're normally called pastries that are inserted into the vagina, or suppositories inserted into the anus. You can also prepare that. So these are the common dosage forms that you prepare, in a non-sterile compounding. I would stop on this slide for today. I see we have 14 minutes more, and I will ask you to give me your thoughts about what it is that we've gone through today, or ask me questions. Otherwise, I'll ask questions in the remaining 14 minutes and then we close. Next Saturday, we continue from where we stop. So, thank you. Questions for me or any thoughts about what we've discussed? Otherwise, I'll ask questions. Any Questions, comments from anyone? Silence means we either have clearly understood everything or we're completely lost on everything. Any questions or comments? Okay, if there are none, I would ask, I would ask, what is one key principle of a patient-centered care? Who can remember what I said when I spoke about principles of patient-centered care? Anyone? Silence? Silence. I mentioned a few principles, and I can say one and hope that we remember the others. I said patient values, consideration for patient values, preferences, and needs. Who can remember another one? I like for the classes to be interactive. It will really be helpful that I know that you're following. It will really be helpful. Has anything I've said today been difficult to understand, assimilate? I like that feedback before we close. Anyone? Deborah? Yes, Deborah? Hello? Amos? Hello, can anyone hear me? So, sorry? Oh, it's okay. I have difficulty hearing you. Okay. I see Arize. Arize, do you have any questions for today? Dr. Goodness, any questions for me?
Can you hear me, sir? Can you hear me, sir?
Yes, I can hear you. Thank you, Arize. Carry on.
Oh, thank you. I just so I'm sorry we lately joined the class, so I not trying to catch
Okay.
up.
Oh,
So, but
okay.
the person the patient centered one key principle of patient centered care is
Yes.
to treat patient with dignity or something, or respect and compassion.
Correct. That will be correct. Absolutely. Respect,
Okay.
dignity, listening to them is really important. It's a key
Yes.
principle.
Okay.
Thank you, Arize. Thank
Thank you,
you.
sir. Thank you, sir.
Thank you. All right. Rose, you have anything to ask me or your thoughts about how today went? Can you hear me, Rose? Okay. So let me just round up. We have 10 more minutes. Let me just round up. And in rounding up for today, started by mentioning that the course was non-sterile product compounding for those that joined us slightly late. Okay, I see your hand, Blessing. Go ahead and ask the question before I close. Go ahead, Blessing.
Yes, thank you, Dr. Yakubu. I remembered during your presentation when you mentioned the patient-centered care, one
Yes.
thing that, stood out for me was the fact that the ideal is to have, the patients involved in their own healthcare decision making, right?
That's
So,
right. That's right.
aha. So, so just thinking what is obtainable today within the
Yeah.
healthcare system, would
Yes.
you, sir, say that you know, vast majority of patients are involved in their healthcare decision, you know, and this could be subjective, sir, but I would
Yes.
like to hear your opinion. Thank you.
Right. Thank you. That's a very brilliant one. And the straight answer, the short and straight answer to that question is largely no. Largely, our healthcare services are prescriptive. And that's why it's important that, we talk about this, and we teach about this. Healthcare is a right. It shouldn't be seen as a privilege. It's a right for you to be healthy. When you go to the hospital, you have every right to be involved in your care. You have every right to your information. You can demand for the information and say, I need to know what test you're going to run on me. I need to know what medications and why you're giving me this medication. So largely in our own climes here, the systems that we operate, I would say, because we have the experiences of working in hospital system, I would say that largely the healthcare system is prescriptive. This is what I'm giving you. This is what you need to take. In fact, sometimes when the patient tries to get involved in their own care, the caregivers take offense. Are you the one treating me, or am I the one treating you? Do you know these things more than me? But in Western geographies, it's not like that. In Western geographies, you have your right to demand what is being done to you. You have the right to a lot of things. So yes, while the professional will remain the professional, he will give professional guidance, professional treatment. It's really important that professionals listen to patients and allow them be involved, because there are certain things you will not know by just observing. Certain things they have to tell you to know, okay, I shouldn't go this way in this treatment. This is the way to go. So that's a brilliant question. I would say there's still a lot to be done to meet that in this our climb. But in advanced countries, of course, they've moved on with them getting involved in their own healthcare and all of that. That's a system where you even have personal physicians assigned to you by the government that you can call on, talk to, and all of that. So thank you for that question. Very brilliant question. By the way, she's also an instructor. I know. So thanks for that question. It helps clarifies and set some more context. But that will be my response. Thank you.
Thank
6
you.
more minutes. Yeah, thank you so much. Do you have any questions or comments? Otherwise, we just call it a day here, and then we continue from where we stopped. Just so you know, I'll start with asking questions in the next class before we continue. All right. We Kwaka, you have a question? Sorry if I didn't pronounce it. All right. Thank you.
Thank you, sir.
All right. So thank you for attending. I will encourage you to come on time for next class, and I'll encourage you to be really free to ask questions in the course of the instruction, and ask questions at the end. We will learn by asking and exchanging, rather than allowing the instructor to just speak all through. Thank you. And if there are no more questions or thoughts, this will be the end for today. Thanks and bye.